we started forming this group, we realized we needed some help because we didn't quite know what we were going to do. We called upon Pam Ryan, who was the social worker at Harborview Medical Center, who by default became a social worker for people with AIDS before Harborview had an AIDS clinic. And she taught us, you know, some things about boundary setting and what are you doing if you're, you know, if you're a non-medical person who's going to be providing support for people who are ill in their homes. And we really appreciated her help. But we didn't, it took a while. We put out word that we had this network and we gave it a name, Chicken Soup Brigade, and we put out word to the physicians in the Gay Sensitive Physicians Network who were beginning to see people with AIDS that if they knew of patients of theirs who didn't have anybody at home to help them out or needed assistance beyond what they could give them, please give us a call and we'll see what we can do. Well, we waited for a while before we had any referrals. Well, finally I got a call from Ann Collier, who was one of the AIDS doctors at that point, and still is, at Harborview. And she said, well, I have this fellow that I have to discharge from the hospital. He doesn't technically have an AIDS diagnosis. We think he has AIDS, but because of the way the diagnosis rules went, he didn't technically have that diagnosis. And he really wants to go home from the hospital, but I know his lover left him, and so there's nobody at home with him in his apartment. And his family has abandoned him, and I can't keep him in the hospital, but I'm afraid to let him go home. So I said, you know, we've got this network, we'll call the Chicken Soup Brigade, maybe we can figure out a way to help him. So I went out and met with him, and that was kind of trial by fire, because this guy was very angry, very rightfully very angry. He had been through a lot of bad things in his life, and he was in a lot of pain, and he was very resentful because of what had happened with his lover and his family. So he was not an easy person to figure out how to help. And that's when we got help from Pam Ryan, and Josh was great about, you know, jumping in and figuring out how do we get some more people to trade off with each other so that we can go, you know, visit this guy. And, you know, I'd go and help him wash his bathtub because he couldn't bend it over to do that, or take him to the pharmacy to get his drugs. And we were inventing what the Chicken Soup Brigade was going to do, just by responding as best we could to whatever came up.